I hope. Okay, so this week's session, we're going to go over a fairly controversial subject in the world of sports, especially for kids. And it's the to tape, to not to tape, to brace, to not to brace, what implications there are when you choose either one, and where we place the taping versus the bracing. And there's a lot of research that supports everything, and there's a lot of research that says not to do either. So it really comes down to a pretty simple set of rules that I've created long ago. And I'm going to share them with you guys and kind of explain to you how to maneuver your way through that. When you get older, it'll be your decision. Right now, it'll lie mostly in the decision of your coach, your parents, and your healthcare practitioners. And then, of course, as you get older, it'll be mostly your coach. But right now, to decide whether you put a brace on an injury or not will most likely come, from somebody like me or your parents. Okay, so first and foremost, I'm going to go over prophylactic taping. So if any of you have ever had an ankle tape job or a buddy tape job, though that white tape that almost looks like hockey stick tape, that is called prophylactic taping. And that means somewhat in a sense that it's preventative. And the white tape is something that we use quite a bit in sport. It works really, really well on ankles. And what we do, the tape jobs when you're using the white tape or the athletic tape, which is called zinc oxide, and we use something called 1.5 inch zinc oxide. And what we use that for is when we tape an ankle, we're actually, every single piece of tape that we put on your body has a role. So the first two, no matter what the tape job is, the first couple pieces that we put on your skin are called anchors. And they're there so that other strips of tape have something to anchor themselves to. Tape always sticks better to itself than it does to just the skin, and hence the anchors. Then there'll be a series of stirrups, and the stirrups are the ones that are really, really important. And this is why we always suggest that if you're going to get an ankle tape job or a wrist, that you get it from somebody who we consider, experienced, because if you put these particular strips in the wrong direction, you can actually take them from a preventative measure and predispose them to an actual injury. So if you run these strips in the wrong order, the wrong direction, then you can actually make them more vulnerable to a weakened ligament and thus a sprain. So the stirrups have to go in the direction that mimic the ligament. So we do not do prophylactic tape jobs for muscles. We do not tape for tendons. And I'm going to explain that later as we go. We only use the white zinc oxide tape to mimic ligaments, and ligaments, as a review, go from bone to bone, and ligaments create structural integrity of a joint. So that's all we're using this for. We don't tape hamstrings. We don't tape quads or pec muscles or any of the rest of it, even though some people think we do. It won't work for that because we can't prevent a muscle from contracting or lengthening, but a ligament we can. And that's exactly what we're going to do with these tape jobs. So let's say, for example, you sprained an ankle, you did an inversion ankle sprain job, and the outside of the ankle sore, it's a little puffy, but you've got a game. What we do is we give you a tape job and we do the anchors, we do the stirrups. Then we have a collection of tape that has a purpose. And those can be called figure eights, heel locks. It all depends on what part of the body we're doing, but they all have fancy terms and they all have a purpose. And this is really, really important. We're not slapping tape on you without a purpose. Every single strand of tape has a purpose and has to be understood and it has to be put on properly. So when we're doing the heel locks and the figure eights, what we're doing essentially is locking that joint so it can't have excessive movement. So we're locking a joint. We've mimicked the ligaments so that we're in essentially what we're doing is we're reducing the amount of movement through a joint. So understand, we are reducing movement. So we're reducing movement to give you some pain relief, to improve healing, and in the moment to improve function that you wouldn't have otherwise. And that's why it's so common to tape before an event. And that's why we do prophylactic. Here's some benefits to prophylactic taping. The nice thing is we can customize it. So the amount of tension or lack of tension, you take my Sudbury Five guys, for example, the average guy on the team was flat-footed. So I couldn't, do my figure eights as far into the foot as I would normally. I had to back them up because their flat feet would actually the tape would cut their arches. But I could customize that according to what their needs and wants are. A lot of guys that I taped over the last 2 years wanted a very, very light tape job, just enough to say the tape was on. Is it effective? Nah, a little bit. But again, it comes down to the fact that I was able to customize it. A brace, I can't customize to that degree. So that's a pro. Another benefit of taping is for about 30 minutes, the tape job is highly effective. It's directly on the skin. It mimics the body's tissue. And because it mimics the body's tissue, the body doesn't see it as much as an external device like it does a brace. So we have less weakening of structures, and we have an actual benefit in the sense that we have compression. And like I said, every strip has a purpose. So we're creating another structure. So our tape job becomes our ankle or our elbow or our fingers. And now you can function almost, as though there wasn't anything wrong with it at all. So those are a few of the pros. It's customizable, and for the first 30 minutes, it's highly, highly effective. The cons, however, is that after 30 minutes, you start to sweat. As soon as that tape comes off and away from the skin a little bit, it now becomes less functional. It's only functional when it's in direct, tight contact with the skin. So when we use if anybody has gotten their ankle tape job and you didn't want to rip off your hair, there is a light foamy kind of wrap we can put under. That is not a proper tape job, and that actually decreases the effectiveness drastically. So anybody that gets a tape job from me, it goes directly on the skin. I don't care about your hair, you can shave it off, but it will go directly on the skin. That's the only way I can guarantee the effectiveness of that tape job. So a con, obviously, is if it's in the ankle or even forearm area, when you rip it off, it hurts. And so a lot of people will default to this foam wrap and put it under, thinking that it's going to work just as well, and in fact it doesn't. So the taping, unfortunately, is a short-term solution, but we can retape, but that's definitely a con. And the fact that the taping is a quick fix. So if you look at the cost of a regular case of zinc oxide, you're looking at about $110 to $150 for 36 rolls. But you will need somebody to tape that joint every single time you need someone to tape that joint. So a disadvantage is it's costly for the amount of time you're going to use it because it's short term. Whereas a brace, of course, would, once you buy it, you've got it, you can put it on yourself. You don't need somebody who's experienced in it, et cetera, et cetera. So I prefer taping when possible, but I'm also going to give you a little bit more of a rule later so that you guys can kind of remember how to and when to tape. I prefer the customizable piece with tape. I prefer the fact that I have a bit more control on the structural integrity that I can get from tape. And I prefer the fact that it's actually better than a brace for the first 30 minutes. And I like the fact that I can remove it and retape it if I need to. So that's prophylactic taping in a nutshell. I do not suggest you YouTube it and do it yourself. I suggest that you leave it to your coach, a trainer, maybe somebody in your family can YouTube it and tape for you. But you to tape yourself have to remember that everything that they do on the screen, you've got to reverse because you're doing it upside down, especially for ankles. Obviously fingers and wrists, those are a little easier, but they're non-weight bearing. So I don't concern myself with the upper body as much as I concern myself with the lower body. And that's pretty much it for the taping. Now, I will go over the body parts and which ones I like to do which with, but I just want to kind of give you an overview. Bracing is the area that brings on the most controversy. And about 2 decades ago, I would say, it became very common that if you were going to be at a university level or above, some high schools, especially in the US, and you were playing volleyball or basketball, you were going to be fitted and you were going to be forced to wear an active ankle, which is an ankle brace. And their philosophy at that time was preventative. So we're going to prevent an ankle sprain by forcing everybody on our teams to wear a brace. That was one train of thought. As we know going forward, if you use a brace when you don't need to use a brace because you don't have a trauma, you will over time create weaknesses in those ligaments. So then thus creating a dependency on this brace. And then the one time you forget your brace in your locker or you forget it in your car and you decide to go for your run or play, you know, a game or whatever without it is when you will in fact roll it. So the dependency that you create on a brace is where this controversy is. And it lies on age and it lies on when and why, what would be the parameters that we would brace an athlete. So braces are for anything. You can brace a big toe, you can brace an ankle, a knee, a hip. There's chest wraps, there's shoulder wraps, there's obviously different wraps for the elbow and the wrist. And there's also some for the fingers. So there are braces for everything you could possibly dream of. From compressive sleeves to the middle range where there's a compression component and a structural component, so hinges. And then they go further than that where they remove the compression component and they put just a tougher, could be, gosh, titanium, there's plexiglass, there's all different kinds of material. And those ones are more like pre and post surgical. And those, you know, obviously have different purposes. So going back to the bracing, unfortunately, it comes down to a lot of the NCAA, mostly, now I don't see it in pro very often, where if the coach says everyone's wearing a brace, everybody's wearing a brace. At that time, for adults, or at least very close to, the growing's complete and training is at a high enough level that we don't worry as much about it. It's the age group that you guys all fall in now that we concern ourselves with. And I'm concerned about what we set you up for. More importantly, the failures that we set you up for by bracing you unnecessarily. So we do not any longer brace children just for preventative measures. Now you can imagine if I was to brace both your ankles and you go stop suddenly or someone takes you out, instead of injuring the ankle, now I've got a bigger problem because now I can actually have you injure your knees and the knees don't heal as well. And now we're looking at surgical interventions. So bracing and supporting one structure makes other structures above and below it actually more vulnerable. And that's one problem. The other problems, of course, are this dependency. So if we go backwards and we look at the pros of bracing, the benefits of bracing are definitely they're long-term. They're not short fixes or quick fixes like taping is. They are fairly customizable. not as well as tape. They do not stick to your skin. So there will always be, you know, a level of space between you and the brace. They they're thicker, denser, obviously carbon, whatever the material is, but the material is definitely stronger in a brace than it is in a tape job, which in some respects is a pro for the tape, because at the end of the day, if someone takes you out, I would still rather you roll your ankle than your knee. So if there's a little bit more laxity in the tape job, that's actually a benefit. It would lessen the amount of trauma, but it would prevent your knee from being damaged. In a brace, it's very unlikely that you're going to be able to prevent the knee from being injured or anything else for that matter. The cons to the brace, we have price, sure. And the problem with the brace is that when do you stop? When do you implement it and when do you stop? And even though when you're looking at the benefits of bracing and the cons of bracing, this doesn't come up very often. But for me, it's when am I done? When do I take my athlete out of the brace once I've put you in one? And that's a very difficult answer, because if I've created a dependency, if I've created a weakness, I have to rehab those. So I've got to take you out of the brace. You've recovered, but I can't put you back because now I've got to rehab you. Because if the ligaments of the ankle and your proprioception and balance and all those things haven't returned to normal, then I've just made you more vulnerable to injury than the reason I put you in the brace in the first place. So you have to understand that bracing is either an all or nothing. You're either going to not brace and we're going to rehab it and go around it, or you're going to brace and you're going to have to brace for the entire season, because most seasons I don't have long enough to heal the tissue, keep you braced, find your risk factors, rehab those risk factors, and then get you back onto the court or the pool or whatever it might be, right? So that I thought was a disadvantage with a brace, and that I find one of the biggest ones. Again, it's not highlighted in a lot of literature, but it's something that I see every single year. And it's unfortunate that once I get an athlete, I have to go through those stages and go, okay, I can't tell you to throw that brace in the back of the closet now, because you're going to have to continue to use it until I can get you ready and % recovered. And unfortunately, that's really tough to do well. So risk factors are something that we look in as practitioners. So these areas around the injury site that have been created due to the injury and due to compensation and due to things like having to brace it in order to help it heal and prevent you from injuring it further while you're healing. So those are two of the things, you know, in terms of stability. There is another thing called kinesio tape, which became really, really common about 2 or 3 Summer Olympics ago, when Kin Tape actually sponsored the women's beach volleyball team for the US. And every single one of them came out with Kin Tape somewhere. Achilles shoulders were the most common, some were in the quad, and it was these flashy colored strips of tape that people started to go, whoa, what's that? What's that? What's that? And it opened this huge market, a multi-million-dollar market, basically came from that Olympics. And it just goes to show you, fad or not, if you have a pro athlete endorsing something, you're going to sell it. And as athletic therapists, we don't kin tape very often. It's not something we believe highly in. It is not preventative. It is not structurally sound. It doesn't create stability. If you've ever seen somebody with a kin tape, it's usually 1 or 2 strips very lightly placed on the tissue. What it does do, however, is it will support the healing process. So you do tissue work. Let's say you're doing lymphatic drainage or you're doing like muscle work. You can support it by placing the kin tape on it in a certain pattern, which will help with lymphatic drainage. It pulls the tissue away from the nerves, so it can help with pain. but not what we would typically use a tape or brace for. We're using it for a purpose that makes you more functional, less vulnerable, and obviously improves the healing. And the kin tape is, I'm going to say this and probably get kicked, is a bit of a fad. It came out like foam rollers. It came out at a time where people bought it hook, line, and sinker. It has a benefit, but it has a benefit that's not well enough understood. And it's kind of like Epsom salt baths. How many people have taken Epsom salt baths and have no idea why? No idea the temperature of water, no idea how much you're supposed to put in, and no idea of what it actually does physiologically. So there's a market in fitness and health that's quite open for these fads. And kin tape, to me, in my world, is one of them. I do not do it. I covered women's volleyball for the OCAs, and I must have had 99% of them want me to kin tape. And I thought, I don't know your injury. I don't know who you are. I don't know your physio or your sports therapist. I'm not kin taping. And they only wanted it because they got accustomed to it. But it wasn't something that was assessed. And, you know, the practitioner thought, we're going to do this because it's going to make you move on the court better. You're not going to feel your pain. And I don't have to worry about you rolling your ankle later. That's not what it does. So very careful and very cautious around starting an athlete on kin tape, mainly because it doesn't do anything that I would tape a body for. And if there's an issue, I would rather fix it than tape it. So, but that's my personal opinion, not my professional opinion. But, you know, a lot of research goes in the direction of kinesio tape. It is more of a physio thing. And that's because they don't do the depth of repair that an AT does, and which is fine. You know, they do a bit of work and they use the kin tape to support the healing process for the days in between the treatments. A lot of people like it. A lot of people like it for circulation. A lot of people like it to take and ease some of the restrictions off their muscles. But I don't think it's something you should be playing a sport while wearing. If your Achilles is tight or injured, then we have to look at that differently. If your Achilles is just a little tight but uninjured, okay, maybe you can convince me of it. But other than that, if there's any trauma to the site, kinesio tape, in my opinion, should never be used. So that's the kinesio tape. Like I said, a lot of people will have different opinions. It's just that you really need to know why you're being taped. And a lot of times it'll be after a physio appointment and you'll stay taped until you go back. And that's for healing purposes only, not for function, and definitely not for sport. So now that that's the kinesio tape part is out, I want to go back and give you guys a rule of thumb, taping versus bracing, and something that you should take with you for years and years to go. I do not tape muscles. I need muscles to work. I need them to blow up and pump, and I need them to reduce. I need them to move oxygenated blood to, and I need them to be able to remove lactic acid and byproducts out. I don't want to put compression. I don't want to restrict movement in the upper body especially. I am not taping prophylactically a muscle at any time. If the muscle isn't working, you're probably sitting. If the muscle isn't working, we can use compression maybe as a compression short, but I do not tape muscles. I tape ligaments and connective tissue. Those are the things that, again, hold your joints together bone to bone. That we do only in the smaller joints. So the white tape that you see, you know, I've done it a million times, tape ankles. I will tape ankles. I will tape wrists. I will tape fingers. I will never tape a knee. I will never prophylactically tape a shoulder or any other joint that requires full movement. I've never done a hip. Toes, I suppose, if you really wanted it. Arches, yes. Ankles, yes. All the joints from the ankle down and the wrist down, 100%. And that's because they're small joints and they're easily stabilized. The knee is a hinge joint. And even though you Google prophylactic knee tape jobs, there's a million of them. They are useless. I've been doing them for 20 years. I have never, ever, ever done one. There just is no use. The lines of braces vary again from just a compression sleeve all the way up. If it's a knee, I will always brace, regardless. I will brace prophylactically. I will brace when I don't know what the injury is for sure and I'm waiting on a diagnosis. I will brace for a minor sprain all the way to bracing post ACL surgery. The knees, I brace all the time. Shoulders, pretty hard. Football and my contact sports, there's something called a Sawa brace, and it looks like a little half shirt, and it prevents the shoulder from going into full rotation. Those are effective because I am trying to immobilize the joint, but I don't do anything else. There is a tape job that uses a different kind of tape. You may have seen it for an AC joint sprain. We put a Hypofix, which is a white, thicker cotton kind of tape. We put it down, and then we use a brown tape literally to bring the clavicle back down to the acromion process. That is highly effective. It's not zinc oxide, and it is a joint. So we are taping for the joint, and we are taping for a spraining and a separation of the ligaments. That's highly effective. Other than that, I don't tape. I don't tape anything to do with the shoulder. We have to recover. If there's a shoulder injury, it needs to recover. The shoulder joint has 360 degrees of circumduction. How on earth do you reduce range of motion in your sports? You can't. So if there's too much pain for you to be functional, then we remove you and we fix it. So prophylactically, so the white tape, ankle, fascia. There are some tape jobs for the Achilles. It doesn't work at all. And then, of course, the wrist and the fingers. Buddy tape jobs are common. There's a thumb spica that's really effective, those kinds of things. The elbow, I would probably brace. I don't think I've ever had, except for, epicondylitis where the elbow joints are sore. There's a sleeve if the elbow's sore on like people who bodybuild and lift that are highly effective. There's a sleeve for the shin and for the calf. And it looks like it's a compression sleeve. That's highly effective. So there's a lot on the market that doesn't fall into a tape job or a brace that can be used. And those are really good temporarily. You don't get hooked on those, and they're better for muscles that might just have a little bit of inflammation in them or a little bit of blood left in them, and it's causing some cramping. So the big thing is to know what the injury is, and to remember that if you come to me with an ankle problem, I'm going to fix it and I'll tape it. There are some really good braces for the ankle. And if this ends up being like a long-term, soccer players, some basketball players have to be braced because the ligaments have been damaged so many times that it's a long-term problem. And if it's a long-term problem, then sure, you may as well invest in a brace instead of spending money on tape jobs every single time. That would be the only time I would, request or suggest an ankle brace. It's highly, highly and incredibly important that we continue to strengthen. We allow the joint some rest, and we also allow the joint to get stronger, increase the mobility, and make sure that the fibers heal properly. If you weaken an already injured joint, then something that might have been short-term is going to very quickly turn into long-term. And those are pretty much the main rules of thumb for taping versus bracing. So, I mean, in basketball, we will see mostly ankles. I've seen a few turf toes. That's just where the big toes or the toes jam into the shoe. That's tapeable. Plantar fascia, sometimes that's tapeable. Shin splints and calf injuries, we would compress with a sleeve. Knee injuries, always a brace, don't tape a thing. Thighs can be with a compression sleeve or compression shorts. Hips, we pretty much have to fix. There isn't a way to stabilize the hip. Low back, I don't touch. There is no type of compression, no type of brace, no back brace, nothing that I will ever use there. Those muscles weaken incredibly fast, and it's imperative that that's fixed and strengthened. Back up to the shoulder, I don't brace. I try not to tape. There are some better kinesio tape jobs for the shoulder to reduce pain and still allow full range of motion. So that would be one spot that I would consider if somebody had to function and wasn't too much pain, but the pain wasn't coming from a trauma or damage to the tissue. It was just, I slept wrong, I have a kink in it, I overtrained, but the integrity of the tissue is good. I would kinesio tape for that. Elbows, again, it would be more what's called a strap. And then wrists, there's some really good tape jobs and there's really good braces. It's just that in basketball, a brace makes it really tough to do any wrist movements. We could tape for that. And then of course the fingers are really good. Going back to the knees for you guys, things that are more common, the patellofemoral, the jumper's knee, the growth, the fat pad impingements, chondromalacias, the Osgood-Schlatters. There's lots of things that we can do with little straps and teaching you how to make things, believe it or not, to reduce the pressure. When you apply pressure on a tendon, because it would be for a tendon, not a ligament, when you apply pressure to a tendon, especially midway, what you're doing is redistributing the force. So when you land or jump, the force doesn't stay in the weakest part of the fibers, which is what it's going to do. So when you put pressure there, it'll just below, usually about an inch, just below that site, it'll redistribute the force over a bigger area, which then decreases the trauma to that site and obviously decreases the pain. So there are more things I would do to a growing kid in the knee, different types of braces, different types of sleeves to get you through that so that we don't weaken the knee with a brace. The braces that I'm referring to are more the hinge braces for the ligaments on the side of the knee and the ligaments deep inside the knee. So the ACL, the PCL, the LCL, and the MCL. And those are ones that don't heal well, and those are ones that require a brace for stability. So I just wanted to backtrack on the knee thing because some of you might have these patellar straps and they're okay. They're not going to weaken anything and they're not going to make you dependent on them. So the straps kind of fall more in line with compression sleeves than they do in the braces themselves. So those are the taping versus bracing rules that I live by. And keep in mind, your doctor could have a completely different mindset. Kyle may, future coaches, but it's more for you guys to be able to advocate for yourself. And if you have those rules of thumb and you remember them, then when a coach is trying to force a brace on you, or another practitioner is trying to force a brace on you, you don't necessarily have to deny it or say, I'm sorry, I'm not going to wear it. But you could follow up with a few key points saying, okay, well, can I tape it? Or, is there another way around having to brace this joint if it's only going to be for a short period of time? And obviously knowledge is power, right? So the more you know about things like that, the better it is for you guys to understand why, as practitioners, we are doing it to you and for you, and why we're suggesting it. And some people sell braces, so they're going to put you in a brace from your nose all the way down to your toes. And that's not the right way to do it. But if they sell braces and you go to their store, they're going to sell you a brace. And that's the way that market works. And if you go to a place that isn't going to make money off the braces, but you're going in and you're asking questions, well, they're more likely to give you a more unbiased opinion on whether you should tape or brace that joint. And, you know, it's like going into a chiropodist that makes orthotics and say, should I have a set of orthotics? Yep, I think you should, because that's what I sell, you know, and as opposed to going to someone who doesn't sell them and say, can I go with a shoe, or do I have to wear orthotics, or can I just put a lift in? Well, the information you're going to get from that person is going to be very streamlined, because it's not going to benefit them. And it's going to be a more honest opinion. And those are the things you guys have to remember, you know, as you guys are aging, and as you guys are learning and your body's changing. You don't want to do something now that you're going to regret in 5, 10, 15 years because you put a brace on a joint and now you can't even, you know, go for a 5-kilometer run without it because the joint is that unstable. So it always ask, you know, and I've said this a few times, don't be shy. You've got a great team in front of you. You have all our contact information. If you have an old brace, if you've been wearing a brace and you're wondering if you should continue or how you can get out of it, or maybe you need to be in it and you're just, you know, have some questions about it, send it our way, and we will certainly help you maneuver through what to do about the brace and whether it's time or something that we can even get you out of. Orthotics are the same, you know, all those external stabilizers and those things that change our body from the outside are things that need to be questioned. And because you buy it and you walk out the store or you walk out of the clinic and there's never a follow-up in 6 months or a year or 2 years to know whether you still need it, you get left going, now what do I do? Should I still have it? I've had it for 8 years. Can I get out of it now? Who answers that question, right? So it's for you guys to now know that if you're in that situation, pose the question. It may take a little bit of detective work to know whether we can remove you from them, but there should be a deadline. There should be some sort of endpoint to, or at least a goal that you guys should be aware of and in control of anytime you are bracing. Taping, not so much. Compression sleeve, not so much. Anytime you put a brace on, there needs to be a reason and an end game, and you need to know what those are. And if you're not following up with the person that gave you that brace months at least, if not a year later, to get you out of it, or to figure out how to get you out of it, or to figure out if they can get you out of it, then they've done you a disservice just by giving you the brace in the first place. Because that education piece needs to be there, and you guys need to understand what you're bracing for and when you can get out of it. So that's my spiel. So does anybody have any questions about braces or taping? Okay, and if you guys want to reach out to me privately, please feel free to. Hey,
I just want to say absolutely perfect. I could not be in agreement more with everything that you said. It was exactly the message I hope that you'd give to these athletes, and then the recording for the ones after. Good. And with your permission, I might even share some of this with our open social media, just because it is a very important message. And we do have coaches that say brace, brace, brace.
Yep.
So they don't want to lose an athlete right now, but you're not doing the athlete any justice down the line. So I just want to say thank you. This is perfect.
You're welcome. Okay, guys. So yeah, if you have any questions for me, you've got my email, get a hold of me. We could do it privately, you know, and again, you know, I know you don't want to make a coach angry, but when you're done with that coach, you move on, and they're not going to care whether your joint is structurally found or not. They're just looking at you in the moment, and you are allowed to have a voice, and you are allowed to voice that opinion and that reason. And unfortunately, it may get you benched, but we can obviously work through that. So if anybody has any questions later on, give me a shout. Otherwise, have a good night, everybody, and we'll see you next Tuesday.